So, good afternoon. Thank you very much, Mr. Patrick. My name is Aguido da Silva, as you can see from the screen. I come from Timor-Leste. So, just like previous presentation, this presentation is about sharing of experience. So, which means that my presentation will be about Timor-Leste's experience in managing COVID-19 related crisis, and what lessons that we have learned as the result. So, as you can see from the slide, the timeline, how Timor-Leste respond to COVID-19 pandemic from the detection of the COVID-19 in the country, how the COVID-19 started, and how we make sure that financial resources are available to respond to both social, economic, and health effect of the COVID-19. So we all know how COVID-19 started. It was first reported in Wuhan around late December 2019. Then it spread across the globe and become what we now know as the COVID-19 global pandemic. So less than 3 months, we detect first COVID-19 in the country. And when the first COVID-19 case was detected, our president declared state of emergency based on the Constitution. So the reason why we declare state of emergency, there are 2 reasons for that. First one is actually to let citizens know, aware, and understand that COVID-19 is in the country. It's dangerous, therefore people need to take precautious measures to protect themselves and also to protect their family and their community. But the most important one is actually to provide constitutional and legal basis for the government to take restrictive measures, because some of these measures will take away some of the freedom that the citizen enjoy from day to day before the COVID-19 pandemic. So the restrictive measure that we took, it is quite uniform, I think, across many countries around the globe. Suspension of international passenger flights, we did that as well. I am sure that in many of your countries also did that. Except we allowed charter flight to still coming in for transportation of medical and medical equipment and essential goods and services into the country to ensure that the country is actually functioning as expected. We also took measures to close our border because we have land border with our neighbor, Indonesia. And then compulsory face mask wearing, and then suspension of non-essential public activities. This is suspension of public activities, the most severe one to the community, to the economy, and as well as to the society, because schools have to be suspended, public transportation has to be suspended, so people cannot travel. Public gatherings, like including religious activities, social and political activities, has to be stopped. But we also did, we also apply restrictive measures on movement of people in the country. So people only allowed to travel from one location to another location was restricted unless they are going to buy food, they are going to seek for emergency medical attention, or to buy medicines. Other than that, people are encouraged to stay home. And so the state of emergency was declared to valid for 1 month, but then it was monthly renewed, and it was only end until November 2021. Subsequent months, we relaxed a little bit in terms of movement inside the country, but the country was still totally locked down. In terms of passenger traveling between from outside the country to across the border, face mask was still in place, and some school activities depends on the detection of COVID-19 case in the country. If the case was so high, then the schools and public activities are actually suspended. It depends on assessment from day to day. So that's how it happened. And after the declaration of the state of emergency, then we established Integrated Crisis Management Center. This consists of different line ministry institutions in the country. It consists of defense, it consists of police department, it consists of health ministry, and even Minister of Finance representative was also part of the Integrated Crisis Management Center. Why this is established? Because it's based on the Constitution. If there's any major like disturbance that affect the country can establish integrated crisis management to respond to that situation. So COVID-19 is one of the examples that allow establishment of integrated crisis management center. So the aim or the function of integrated crisis management center was to develop strategic response and guidelines in relation to public health and improve response capacity to outbreak of COVID-19. Another function of Integrated Crisis Management Center was to ensure allocation of resources and implementation of all measures and actions necessary to prevent and mitigate the outbreak of COVID-19. Another one is actually public education, to disclose educational information, how many people were infected in certain days, how many deaths, and confinement information, and so on. And then after the establishment of Integrated Crisis Management Center, we then established COVID-19 Fund. The purpose of the fund, there are two purposes. One is actually to provide capacity for health sectors to respond effectively to the outbreak of the COVID-19. Another one is actually to address the economic and social effects of the COVID-19. So due to some political circumstance in the country, when the COVID-19 hit, we did not have state budget for that year. So in accordance with our law, when there is the budget has not been approved by the parliament and promulgated by the president, we enter into what we call duodecimo regime. So duodecimo regime is actually, until the new budget is approved, the budget is actually allocated on monthly basis. So the calculation is based on last year's budget divided by 12. So each line minister, for example, a line minister has budget of 1 million, for example. It has to be divided by 12, and it's allocated on monthly basis. So what it means is actually there was no budget available to finance any significant expenditures related to fighting and mitigation into the spread of COVID-19. However, luckily, a lot of people were quite scared, I would say, and they thought it was very dangerous, and how should we respond to it if we don't have any financial resources. Therefore, on it's second, but it should be on 6th of April, based on the proposal from the government, the National Parliament unanimously approved special budget with initial value of 150 million for establishment of COVID-19 fund. So based on our Financial Management Act, the government can establish a specific fund which is included in that budget, state budget calculation, but it is independent fund for a specific purpose. So as I mentioned before, the purpose of COVID-19 fund, what it is for health sectors to mitigate the spread of COVID-19 and to finance the social and economic effects of the COVID-19 in the country. So because there was a requirement, the need to increase the total budget, initial budget, which was 150 million. So in June 2020, additional 70 million was approved by the National Parliament to be part of the COVID-19 fund. This is specifically to finance economic stimulus package to reduce adverse effect of COVID-19 pandemic on the population and on the economy. So therefore, the budget of COVID-19 by June 2020 became 222.2 million. And also, there's a rule for the COVID-19 fund. The policy of the fund also allowed to accept any donation from external sources. So we also received 0.8 million from International Labour Organization directly into the fund for the purpose of funding operational costs related to payment of subsidies to households during the COVID-19 pandemic. So our state budget for 2020 was only approved in October 2020, which increased the COVID-19 fund to 333.2 million. So the total budget of that year was 1.4 billion. So apart from 1.4 billion, 333.2 million was allocated to COVID-19 for the two purposes that I have mentioned earlier. So as you can see that the COVID-19 fund has been around, started from 2020 and 2022. Although the total budget of the country is actually increased from 2020 to 2022, but the COVID-19 fund has been slightly decreased over time. So first we started with 333.2 million, and then 2021 became 287.6. As now 2020 we still have COVID-19 fund, but the total budget of this year for COVID-19 is only 56.4 million. So how the COVID-19 fund was managed. So although the fund is kept in a Treasury authorized account at central bank by the COVID-19 rule, its utilization is separately managed by the COVID-19 Fund Management Board. And COVID-19 Fund Management Board is chaired by the Minister of Finance, but with its members consist of Minister of Foreign Affairs and Cooperation because of external relation in relation to vaccine purchase and medical equipment purchase to mitigate COVID-19, but also Minister of Health, Minister of Coordinator for Economic Affairs in relation to addressing the adverse effects of the COVID-19 on the economy in the country. So, but the COVID-19 Fund Management Board has its board, and the role of the COVID-19 Fund Management Board was, or it still exists now, is actually to approve expenditure related to fighting and mitigation and propagation of the COVID-19, presenting regular information to the Council of Ministers and the National Parliament on the allocation and progress of the budget execution of COVID-19 fund, and as well as approving rules and regulations that are necessary for the appropriate functioning and effective expenditure of the fund. The management board of COVID-19 fund is assisted by a technical secretariat, which I am also a member of the technical secretariat, responsible for case management, analyzing information and documentation relating to payment requests, prepare proposal for decision of the management board, and as well as prepare management board meetings and financial report. So financial report of the COVID-19 was separate from the state budget. It was required to be quarterly and on annual basis based on the COVID-19 fund management rules. So technical secretariat is actually headed by, normally by the director of budget as the president of the secretariat, with a vice president from Treasury and 19 other members from Ministry of Finance staff, who have roles ranges from budgeting, legal, payment processing, monitoring, accounting, and reporting, and as well as case management. And large proportion of the members of the secretariat are from Treasury. Therefore, case management, payment processing, accounting, and reporting are the responsibility of the members of the COVID-19 fund secretariat from the Treasury. So during the COVID-19 fund declaration of state of emergency, the members of technical secretariat of COVID-19 fund considered as the essential staff. Therefore, they were required to come to work during the state of emergency. So just as usual, our budget execution is using established government financial management resource planning, which is free balance. So COVID-19 fund also required to actually use established free balance system, GRP system, to execute the COVID-19 fund. COVID-19 fund has decree law to regulate. It's been altered once. And it also has standard operation procedures regarding the utilization of the COVID-19 fund. And to ensure effectiveness and compliance to existing rules and regulation governing COVID-19 fund, the fund also subject to regular spelling errors, scrutinization by the national parliament and as well as by the Court of Audit. So we have been requested to provide documentation in relation to payment of COVID-19 from time to time since 2020 up until now by the Court of Audit. So the distribution and execution of the COVID fund is structured based on programs, sub-programs, and activities. And the fund's distribution process is led by the Integrated Crisis Management Center and is carried out in consultation with relevant line ministers and institutions involved in the prevention and mitigation of COVID-19. This means that Integrated Crisis Management Center must submit the fund's distribution plan to Interministerial Coordination Commission for discussion, decision before submitted to the Funds Management Board for approval and execution in accordance with established programs and sub-programs that are approved. So this is the budget plan and programming cycle of COVID-19. It started with Integrated Crisis Management Center. It collects information from line ministers involved in prevention and fight against COVID-19. And then, based on the information collected, the Integrated Crisis Management Center will elaborate, define program, sub-program for budget allocation. And then it will move to Interministerial Commission, which will approve programs, sub-programs, and the budget that are approved and presented by the Integrated Crisis Management Center. And the next one, it will go to Management Board of COVID-19 to schedule meeting with implementing line minister to approve plan activities structure based on program and sub-program. And the next level is actually execution of COVID-19 fund by the Management Board and as well as Technical Secretariat and implementing line ministry. So in terms of the distribution of the fund, from the 330.2 million, it was distributed over 3 programs. First one is prevention and mitigation directed to health sector, procurement of equipment and medical equipment needed by the health sector to fight and mitigate COVID-19. And we also have program to access to food, non-food products and service worth 18 million to improve access to goods and services during the outbreak of COVID-19 pandemic, taking into account that the pandemic has the potential to affect the price and supply of food worldwide and also in the country. We have budget allocation for agricultural sector to increase food production inside the country. So as mentioned earlier, the Technical Secretariat, Treasury were also considered essential staff, therefore we require to continue to perform our tasks during the state of emergency. However, apart from ensuring smooth operation of COVID-19 fund to meet its intended objective, staff members at the Directorate General of Treasury also responsible for performing usual tasks in relation to Treasury operations, like that are not related to COVID-19 fund, like cash and debt management, accounting and reporting, and expenditure management for the normal state budget. So during this crisis, the Treasury resources were overstretched. However, we still to perform until the end of the state of emergency after more than 50% of the population are fully vaccinated. Just also want to mention that during first and second year of execution of COVID-19 fund, there was a huge challenge because it involved complex process and operation as it required large amount of urgent payment requests, which were essential to mitigate and fight against the spread of COVID-19, especially payment to individuals such as intensive for tens of thousands of frontline workers, educational institutions for exemptions of tuition and internet connection fee for homeschooling, and payment to hundreds of thousands of low-income households, and as well as food basket distribution to minimize the adverse effect of COVID-19 crisis on the population as well as on the economy of the country. The most challenging payment was payment to low-income household families across the country, and as well as food basket distribution, which required intense coordination and verification process to ensure that there were fairness, effective, accurate, complete, while still in compliance with existing rules and regulations. So the year 2020 and 2021 also the most challenging for Treasury Timor-Leste, because we face two crises at the same time, COVID-19 crisis and as well as natural disaster, such as flooding that caused destruction in most parts of the country. Therefore, we processed the highest number of payments that has ever managed and processed through Treasury, which require more careful decision, analysis, consideration compared to any other years in our history. Despite of this, cash management was effective and cash liquidity was also ensured. Procurement issues and challenges related to medical supplies and medical equipment was, we can say that we managed to mitigate, because the government managed to establish contract with the UNDP to conduct procurement process internationally on behalf of the government of Timor-Leste to ensure quality and value for money, and transported into the country using charter flights. So when the first COVID-19 hit, we did not have tests in the country, so we have to send our samples for testing and confirmation in Australia, while we were waiting to establish our own testing in the country. It was also a challenge because the airline company, they want payment on time, and late payment might delay in terms of transportation of the samples, and therefore it might affect timely testing and confirmation, and will affect in terms of decision of the authority to make local confinement and easier for contact tracing to prevent uncontrollable outbreak in the country. So we have to manage that to make sure that the payment to the airline companies for transportation of the samples were on the right track. However, the Interministerial Task Force and the establishment of COVID-19 Crisis Management Center, and as well as COVID-19 Fund, and also our resilience helped us to actually overcome the challenges that we have never faced before. And we can also allow the country to effectively control the outbreak and manage its adverse effects, both socially and economically. So the effect of COVID-19, most countries around the world suffered the consequence. We also suffered the severe consequence. However, according to WHO information, until 19 September 2022, total confirmed cases that was detected in our country was 23,239. That represents 2% of population of 1.3 million, with 138 recorded deaths and 55% of the total population fully vaccinated by the 19 September, compared to the worldwide vaccination rate, which is 64% by 19 September, according to the WHO data. During the year 2020, Timor-Leste economy suffered from COVID-19 pandemic impact, especially on the main export agriculture, because our main export agriculture product is actually coffee, and due to restriction, there was also impact on coffee export to outside of the country. And our annual GDP for 2020 fell by negative 8.3%. However, in 2022 rose to 2.9%, and it is expected that it will reach beyond 3% by the end of 2022, as the adverse effect of COVID-19 shows signs of improvement. Going forward as Treasury, we plan to increase our human resource capability to develop our resilience in facing future crises, not only in terms of global pandemic, but other crises such as natural disaster and maybe potential social disorders and so on. Update our strategic goal by not only focus on normal Treasury operations, but establish goals and plans that are contributing to social and economic development, economic diversification, because so far our income to finance our budget is actually heavily dependent on fossil fuel or petroleum fund. And we are also intend to help government find alternative source of income. As I mentioned, instead of relying on fossil fuel, petroleum fund, we need to gradually move away from that source of funding of our budget. We also intend to provide advice to the government in exploring possibility of state involvement in commercial activity and private project. We also recently have used PEMNA advisory service program to explore possibility of introduction bills and bonds in Timor-Leste. We have never done it before, so we don't know how to do it. So we are now establishing connection to learn some skills, and hopefully we can implement it to help us to access to short-term financing to our state budget. We also now work with Asset Directorate and key line ministers for maximization of public asset utilization to increase efficiency and contribute to domestic revenue. We also plan to introduce accounting standards. So far, we don't have accounting standard in the country for private sector for a more effective tax collection and help develop financial sector in Timor-Leste. So I think that concludes my presentation. If you have any questions, our team will be happy to respond to your question. Thank you very much.